Am I hearing you correctly that your conclusion, as somebody whose PhD focused on morphine, as somebody who was the head of respiratory illnesses for Pfizer globally, and therefore has that respiratory expertise, having looked at Stuart Wilkie's evidence on midazolam, that your personal conclusion is that the state deliberately put people on midazolam and morphine for the purposes of terminating their lives?
Yes, there's no question. They use doses. Well, neither of those drugs would ever be appropriate in an open airway breathing patient. So if someone arrives and they're able to breathe, even if they're breathless, you would not repress their respiration, which midazolam and morphine would do. And also, per many bits of information that Stuart Wilkie was able to show us, the doses that we used were between 3 and 5 times the recommended initial starting doses. So I wrote them down and I went back to look at my clinical pharmacology books. Indeed, those are doses that you would expect would lead to a fading away of people, certainly if they were given repeatedly day after day. So I personally am convinced that the excess deaths in care homes is explained by this procedure substantially. I think we're looking at 6 figures, over 100,000 people easily.